Federal study of Medicare recipients finds coronavirus impacting blacks disproportionately. Black people on Medicare have been hospitalized at a rate that is more than 4 times that of white beneficiaries. According to a federal data analyst that for the first time details the disproportionate impact the coronavirus pandemic is having on people of color. The Centers for Medicare or Medicaid Services on Monday released the findings as part of an effort to develop a fuller national understanding of racial and other disparities in coronavirus infections and hospitalizations. The Trump administration pledged to provide data during a White House coronavirus task force meeting on April 7th. This information provides governors and other policymakers an opportunity to be more focused and targeted on vulnerable populations, said CMS Administrator Seema Verma. It's not only seniors, but to really focus on our low-income seniors and our people going through dialysis. She said the U.S. health system needs to be reoriented so that provinces are paid. Providers are paid based on health outcomes instead of just providing a service. That shift also pushes providers into taking into account so-called social determinants, such as accessing to food or housing that can affect health outcomes. Black people on Medicare, a program for people 65 and older, had the highest hospitalization rate for coronavirus, with 465 cases per 100,000 beneficiaries. Hispanics had 258 hospitalizations per 100,000 people on Medicare, and Asians had 187 hospitalizations per 100,000 people in the federal health insurance program for seniors. White people on Medicare had 123 coronavirus hospitalizations over per 100,000. Each hospitalization cost Medicare about $23,000. The federal government and some states have been looking to new payment reimbursements that encourage doctors, hospitals, and other providers to also address the underlying issues behind health and disparities. This would mean helping people who don't have housing get housing, or helping people get better access to health foods can help prevent illness and aid with chronic conditions. Supporters say in return they are less likely to be sick or to use the emergency room for care. Some states have begun incorporating new payments or models into Medicaid, hoping it will drive health improvement and a reduced use of health spending. The Trump administration, however, has also taken steps that have created barriers, including approving state plans to link Medicaid and to work and a reduction in funding for preventive care.